Hello everyone. Today I will discuss two common gastric system disorders with you. Now these disorders are called diverticulosis and diverticulitis. They are very common for elderly people, especially for those who do not keep healthy diet. Diverticulosis is a condition when small pouches or pockets start to form on your large intestine. So these small pockets or pouches, we call them diverticular. Now, if these things start to develop on the wall of your large intestine, then this condition is called diverticulosis. Now, if these pockets start to become infected. Now, this infection, we call it diverticulitis. So we know that. So now we know that these two conditions are connected. Now, first people will have diverticulosis and then will develop into diverticulitis. So what are the causes of diverticular disease? Why these pouches or pockets start to form on your large bowel? Why is that? A very common reason is old age and poor diet. Now, the scientists actually found that more than half of all adults over age of 70 have this condition. And most of the people who have this condition always have a low fiber diet. And scientists also found that, diverticulosis is common in Western countries and less common in Asian countries. Now, many people in Western countries, they keep a low fiber diet. And this could really lead to diverticulosis and make these little pouches and pockets to start to grow on your large bowel. Another interesting thing is that Western people develop diverticulosis normally in the last third part of the colon, while people in Asian countries such as Japan, Taiwan, and Singapore, they generally develop diverticulosis in the first section of the colon. So we know that, culture and countries could be related to the condition. Now, if you have diverticulosis, what are some symptoms? The normal symptoms include abdominal pain and bloating, constipation and diarrhea, flatulence, blood in the feces, however, it is usually minor, and anemia. Many of these symptoms actually are very similar to bowel cancer. So when people see blood in the feces, they might get really panic. But in most cases, it could be diverticulosis because bowel cancer is not common. So the best way for you to detect your problem is to get an examination from the doctor. Now, if diverticulosis develop into diverticulitis, now the symptoms could get worse, including sharp pain, normally located at a specific point or on your abdomen, and high fever, increased temperature, and distension or bloating of the abdomen, or nausea and vomiting. If you have these symptoms but you don't get treatments on time, this could get worse. If the pocket gets really weak on the bowel wall and start to rupture, now the contents inside these pockets or pouches start to leak into the bowel and then cause very severe infection, and you could feel severe pain and high fever and chills. We call it perforation. So we don't want that develop. So it's best way is to seek help when you have these symptoms. Now, how can doctor diagnose this disease? Normally, doctor will do a colonoscopy. Colonoscopy is like sending a tube through your anus into your bowel At the tip of the tube, it has a camera, so doctor can see, okay, what's really happening inside your bowel. Where are those pouches and the pockets start to grow? So this procedure is called the colonoscopy. Now, how can we treat diverticulosis? To treat this condition, the best way is to switch your poor diet to healthy diet. Increase soluble fiber. Now, what kind of foods are rich in fiber? So it is suggested that people should consume more green vegetables, oat bran, and fiber supplements. So if you eat if you consume more vegetables with green leafy vegetables and fruits, you will have less chance to have diverticulosis. So remember, consume more vegetables which contain high fiber. Consume high fiber diet. Don't eat fatty foods. Reduce your fatty foods. Don't eat like deep fried, oily foods. Any food that contain high amount of fat. Try to reduce it. Don't drink. Reduce the amount of alcohol consumption. If there is an infection of your bowels, you should start to take antibiotics according to doctor's order. Now, if it's getting worse, you should maybe receive surgery. And what are some self-care suggestions? Now, to make a conclusion, increase your daily intake of green vegetables. Introduce fiber gradually in your food to avoid unpleasant symptoms such as flatulence. Consider take regular fiber supplements. Drink plenty of fluids to ensure your stools are soft, moist, and easy to pass. So avoid constipation. You need to make sure you drink like at least like 1.5 to 2 liters of water every day. And also finally, should exercise regularly to encourage the bowel motion. We know that regular exercise, slow running or walking could increase the movement of your bowel and prevent constipation. So I hope really this lecture could help you gain like more understanding about what is diverticulitis and diverticulosis and what things we can do to prevent this